So today I'm happy to take part in this documentary to showcase the partnership that we have had with Connect to Retain in AYP programs.
Global Fund HIV grant is being implemented in Kilifi County, and Connect to Retain implements it in Kilifi South Sub-County.
Je, mnaona mmepata faida? Mungependa tuachie hapo ama tuendelee?
And possibly share with you the achievements that we have made for the last two years.
We conduct community-based outreaches to adolescent and young people for HIV prevention and risk reduction.
We offer all the services outside the facility, like in schools or in community centers, in churches, in mosques, so as to make sure that we get to attract youth to come for healthcare services.
Mimi ni mwalimu wa afya, public health officer, na mimi kwa siku ya leo niko hapa kuwakilisha Department of Health ama kitengo cha afya kaunti ya Kilifi. Ningependa niseme jambo moja, haya maswala ya SGBV ni maswala ambayo tuko nayo kila siku, na ikiwa mtu uko na shida, mahali pa kuanzia ni kuitaja. Kuna watu wengi sana wajui yale mambo tumefundishwa hapa, si ndio hivyo? Na pia katika sehemu zetu tunazotoka, sio vijana wote wamepata fursa ya kufika hapa, si ndio hivyo? Na sisi wale ambao tumebahatika kufika hapa, nina hakika tutaweza kufikia na vijana wenzetu wengine, na tutasaidiana kwa pamoja kupunguza kesi za dhulma za kijinsia na mengine mengi ambayo tumeweza kujifundisha siku ya leo.
Connect to Retain implements 2 modules in the Global Fund HIV grant. That is prevention programs for adolescents and young people in and out of school, and human rights and gender module. In the prevention programs for adolescent girls and in and out of school, we implement several interventions. We have evidence-based interventions. These are NASCOP certified sexual reproductive health curriculum with the age-appropriate messages. We have healthy choices for a better future, which targets adolescents between the age 10 to 12.
During these outreaches, I can mention of very nice success stories that we had just recently in early February this year. We went to the outreaches, we attracted so many youths to come in Ziani area, and one of the youth that we screened turned out to be positive, and she was just a from 2 secondary students. It is through these outreaches that we were able to trace and identify her. If it was not for these outreaches, this girl will most probably right now have not known her status, possibly HIV viral load increase and then now go down with opportunistic infection and even further lose her for no good reason. But I am happy now and I'm proud to say that the identified student is currently attached to Chasimba Health Center and is under care and is using ARVs, very healthy, back to school. We did not stop there. We also engaged the family. We called in, counseled them, and even go further and engage the headmaster of the school so that we can all work together. The health department, the school department, and the community that is referring to the family at large.
Connect to Retain implements the program in all wards of Kilifi South, that is Chasimba, Mwarakaya, Mtepeni, Shimolatewa, and Junju. 5 key staffs are fully employed to implement the program. That is the program officer, the field officer, the M&D officer, the finance officer, and the CEO. We have other facilitators who help in implementing the program. We've trained 54 EBA facilitators who facilitate EBA sessions. We've trained 18 peer educators who help, who sensitize the community. We have 25 community adolescent treatment supporters who help us in treatment adherence. And then we have 20 SGBV champions who sensitize on SGBV at the community level. We have 6 paralegals who follow up on SGBV cases. We have 6 Know Your Rights facilitators who sensitize the community on their rights. And finally, we have 2 county TOTs.
Through the staffs and through the partnerships, now the outreach has grown.
Jina langu naitwa Jensai. Nimefanya kazi kama mentor, na mentor kazi yake ni kuelimisha jamii. Kabla mradi huu uje katika wodi ya Shimo la Tewa, kulikuwa na visa vingi vya wasichana kupata ujauzito katika umri mdogo. Walikuwa basi wanaacha shule, wanaanza kulea watoto. Mradi huu ulipokuja, ulikuja na jina unaitwa Adolescent Girls and Young Women Program. Imewafaidisha sana, lakini niombi kwa shirika kwamba mradi huu bado unahitajika katika vitongoji vyetu. Thank you so much Connect to Retain, and God bless you Nasim for the good work you are doing together with the all staffs of Connect to Retain.
Rahabu Amoge, muuguzi Junju Dispensary. Nachukua nafasi hii kushukuru shirika la Connect to Retain kwa wakati ambao tumekuwa nao katika hali ya kutenda kazi ya youth outreach katika maeneo yetu ambayo tunahudumia wagonjwa wetu. Katika hizo outreach tumeweza kuona manufaa. Moja wapo ikiwa ni uhusiano wa karibu kati ya vijana na sisi kama wahudumu wa afya. Yani the relationship between adolescents and youth and the health workers imebadilika. Ule uoga walikuwa nao hapo mbele umeisha, ya kwamba wanaweza toka manyumbani wakiwa na shida za kiafya, hasa on reproductive health, wanakuja confidently kwetu kuweza kuseek for help and also for counseling and guidance.
Na hii ikiwekwa inakaa miaka mingapi? 10, 12. Lakini hata kama hiyo miaka 10, 12 haijafika, unataka kupata mtoto, unaruhusiwa, unaweza kuja ukasema na ikageuzwa.
They also mobilize for legal aid clinics which are conducted at the community level. We have a pro bono lawyer who gives legal advice and legal aid to survivors of gender-based violence.
2019, we had 1,275 teenage pregnancy, but luckily, with the intervention that we have put, we have seen a downward trend, reducing in 2020 to 1,093, and currently in 2021, we have had only 253 teenage pregnancies so far. So these are some of the great improvements that we are seeing because of this useful involvement in issues of sexual and reproductive health care.
Tukikutana tunafundishwa kuhusu HIV, rape, teenage pregnancies, hope to teenage mothers, causes za rape, types of rapes, mtu akiwa rape anafanya nini, anafaa ende wapi, na vitu venye anafaa kufanya na mengine mengi.
Yeah. Okay, so another thing, types of rape. Yeah, ukasoma gani? Hapo naona kumenyamaza hapo. Mniambie juzi msoma nini?
In the M&E department, we have a data clerk and also an M&E intern. Basically, what happens in the M&E department is that we are a link between the SR, which is Connect to Retain, and the PR, who is the principal recipient. And we ensure quality assurance in terms of reporting, strengthened internal controls in terms of reporting, validation of data, collection, and also presentation of quality data.
As a finance department, whereby I'm the head, we offer the oversight role for the organization, whereby we advise the management on the expenditures. We advise also on the value for money. We also basically offer a linkage between the donor and the recipients, whereby we see the proper utilization of funds, whereby we make sure and confirm that there's a channeled and proper way of how funds and benefits reach the recipients.
We have also developed a multi-sectorial coordination framework tool for GBV that is awaiting approval and adoption by the county government and other stakeholders in the county.
Mi kama peer educator huwa nina mobilize for outreaches kwa community zenye huwa tunapeleka huduma za afya nyanjani. Katika outreach huwa tuna target 40 participants, wavulana na wasichana kuanzia miaka 10 mpaka 24. Services zenye huwa tunapeana kwa outreach huwa kuna counselling, HTS counselling, cervical cancer screening, STI screening, FP services, HIV testing. Wenye service providers wenye huwa tunatumia kwa outreach, watu kuna HTS counselors, nurse na clinical officers.
Last year viral load yangu ilikuja ikashoot, so ukapata hospitali wako worried, wakaniita wakaniongelesha, nikawaambia sasa kazi yangu imeenda chini, hakuna vile naweza kusurvive. Ndio nikaambiwa kuna connect to retain, wakaniunganisha na wao, nikapelekwa training ya community adolescent treatment as a adherence supporter. Kupitia hapo nimepata kujua mengi na niko na successful story kwa saizi nimesuppress na niko na mtoto wangu na ako negative. I'm proud of that as I am living HIV positive. Nimebreak hiyo chain through kutumia protection, kutumia dawa zangu vizuri na kuelimisha wale wengine.
My name is Richard Liki and I'm 20 years old and I'm HIV positive, proud of myself. I'm a CAT community adherence treatment supporter in Kilifi South, Shimolatoa ward. We as young people living with HIV here in Kilifi, we have our own challenges. Number one, stigma. Most of us have stigma, and stigma is the thing which is really making us have high viral loads, because wengi wetu tunaogopa sana kwenda hospitalini. Kitu ya kwanza, akifika hospitalini, akifika pale anaona like akiona tu labda mtu ambaye anamjua pale, anarudi zake, aende hata kuchukua dawa na maybe hana hata dawa ya kesho. So these people, our fellow young brothers and sisters, watu tunafuata manyumbani monthly. So tunaongea, unauliza kama wako na any challenge, kama wako na any issue, kama dawa zake anameza vizuri, anatuambia kama anameza vizuri, kama wako na pia shida yoyote anatuelezea, ambayo kama ni ngumu kwetu tunaambia the facility, and then the facility tunamhand over and then inamsaidia.
Mi advice yangu itaenda kwa my youth. Tunapitia challenges mob, lakini naona tu hawezi toa stress na mogoka ama uende ukalewe. Mimi naona tu focus na maisha. Sawa, kazi hakuna, lakini ukipata connections unapata kazi na maisha yako inakuwa vizuri. Sioni haja ati maybe hauna kazi unajipea kwa sponsor hivyo uchezewe ndio upate hela, na kuna makazi mingi tu. Chini naweza advise ni kwanza tu na chini, si lazima mtu anze na juu. Weza anza tu kufungua maybe makaa, viatu.
Kupitia hiyo connected to retain, zamani ilikuwa sielewani hata na machifu, maana chifu kama kesi atakakufanyia hapo Kangaroo mimi naichukua. Sasa connected to retain ikaja ikaelimisha machifu, ikaelimisha wazee wa mtaa, ikaelimisha polisi, imeelimisha hata UCS so far. Sasa hizi wameanza kunitambua na ninafanya kazi nao.
All this achievement will not have been possible without support from several people, and I want to make use of this opportunity to give my sincere appreciation to the county government of Kilifi under the leadership of our able governor, Honorable Amason Jeffa Kingi, for all the support that he has given us. The Department of Health under the leadership of Mheshimiwa Charles Dadu, all the support, the advice, the criticism that has given us to make sure that we perform best in issues of AYP, but also in other issues in Kilifi South.
Also, I would love to give much appreciation to the Kilifi South Sub-County Health Management Team, especially the MOH, for the support they gave us during the implementation of the grant. It would not have been possible to implement it without their support. And I'll not forget the board members who have always been together with the team in support in implementing this grant.
Shukrani zangu za dhati ziwaendee Connect to Retain, donors wote wenye wamefanya kazi na Connect to Retain, Kenya Red Cross, community na wafanyikazi wote wa serikali kwa kuturuhusu kuendelea na hizi outreaches. Hata wakati wa corona pia wameweza kutuachilia na kuturuhusu tuendelee na outreaches.
Last but not least, I also want to give my sincere appreciation. You know, in Kilifi South, we really value partnership, and we know that we cannot do it alone. Hakuna one-man show in this world. So I want to give my sincere appreciation to the partners that we have worked together, Connect to Retain, Red Cross. Thank you so much for the input that you have brought so that we can all achieve and celebrate these achievements that we have had. For the youth in Kilifi County and Kilifi South in particular, this is my message to you. For this world to achieve equal access to resources, to opportunities to girls, youth, women and adolescents, we must address the issue of reproductive health care services. Without addressing that, the world will never achieve equal access to opportunities and resources. And I'm happy, under the Department of Health, especially in Kilifi South, we are trying our best to make sure that we offer these services at your own comfort, at friendly services. So I would like you to make use of these opportunities that you have provided. Feel free to visit our facilities to get any reproductive health care services you want. Feel free to join the youth-friendly center that is there in Mtwapa Health Center of Excellency. And by that, that's the only way that we can all join hands and make sure that we offer a comprehensive reproductive, a comprehensive sexual health care services within the sub-county and the county at large. With these so many remarks, I want to wish my colleagues in the sub-county health management team and healthcare workers all the very best in their life. May God bless Kilifi South. May God bless Kilifi County. May God bless Kenya. And please stay safe. Put on mask, sanitize, and keep social distance.